I wanted to know all about these new products and new ways to treat patients. And the more you talk, the more excited I got. So which product of the ones we talked about really gets you excited? I wanted to know all about these new products and new ways to treat patients. And the more you talk, the more excited I got. So which product of the ones we talked about really gets you excited?
I would have to say, man, we're just leading right off with this. And I'll say at the time of recording of this podcast, we do not currently have any type of official relationship with any of these companies that I'm going to mention right now. Now that could change, but not as of today. So just a little preface, I'll leave everybody kind of on the edge of their seats for a minute, is, we always get a lot of questions about, one of the talks I've been doing a lot over the last year or so is profitable hygiene still possible, right? With the elevated compensation, requests from hygienists and the reduction in reimbursements from PPOs, right? You kind of have this perfect storm that's happened over the last few years. And so a lot of teams are wondering, is this possible to even have a productive hygiene department without really packing them in and making it into a mill, and nobody, I don't think, really wants to go that route. And so we always look at how can what we recommend for our clients and how can what we do as clinicians as well be a triple win. It has to be a win for the patient first and foremost, for the providers that are actually doing the treatment, and then also for the practice. And so expanding the hygiene service mix is something that we have taught for years. And the great thing is that now there are so many additional products that are coming out that are very high quality and provide a huge level of service and care for our patients. So I would say the one that I'm honestly the most excited about is probably Curodont, which is by a company called vVardis. It really is a revolutionary product. It is a biomimetic, so it mimics, right, the natural process of remineralization in the tooth. And so it is a very easy to apply solution that is applied chair side and in a very incipient decay. Instead of just watching it, it can actually be treated, and it builds a scaffolding of peptides, which then pull in hydroxyapatite from the saliva, and it can regrow enamel. So it can heal some of those areas that we would typically watch. And what do we watch them do, Teresa?
It just get worse,
Yeah, they just get worse.
Watch them
right?
get
They
bigger
progress.
and bigger. Yeah.
They progress into the dentin, and then they require, surgical, removal of that and a restoration that then needs to be replaced, 10, 15, 20 years later. And the story goes on and on. So I'm super excited about that. And we have quite a few of our clients utilizing this technology now.
Well, we also have a new procedure code for it, and that's going to start and be effective. 2024. So I asked Rachel in the pregame, so who can apply this, doctors or hygienists? And she said, anybody that can etch. And I was like, ooh, I can etch. And then she's like, anybody that's allowed to etch. And that's different. So, because I can etch, but I'm not
that is allowed to etch based on the state, dental laws and regulations.
Yeah, let's be clear about that. Because sometimes, the old assistant Teresa pops up and then, and then she goes back in her hole again. But but it's exciting for me because when I was attending the code maintenance committee meeting and they put this code up, it was one of the fastest approvals of a procedure code I've ever seen. Yeah. And the reason is, and a lot of people, there's a lot behind this. So I'll just really make it a quick explanation. When you come with a new code, it cannot be product based, because if it's a product coming in, they're going to be like, no, you just want to get your product approved. But they had so much documentation, clinical background on the modality, how it actually works, the scaffolding that you were talking about. And the way they presented it was so super easy to understand that even the people in the peanut gallery like me just sitting there, they broke it down so easily. And so it really was one of the fastest approvals I've seen by the committee. And so that got me excited. I started looking it up, and there were some doctors there that I talked to, and they were sending me studies and all that. And from a layman's point of view, I don't have your clinical background. I don't have a doctorate and nothing. It was easy to understand, which tells me when we talk to our patients about it, it's going to be easy to understand. And so as an administrative team member, please understand the mechanics of this so that you can have the same conversations that are going on in the back, because I do think this is going to save so much tooth structure in the future. So yeah, super excited about it. I'm glad you brought that up. And yeah, vVardis, right? It's kind of a weird name. vVardis.
Yep. It's a Swiss company founded by two Swiss dentists, female Swiss dentists. Yeah. So they do, and it's been used in Europe for many year. So there's a lot of scientific data around it. And there were, in late 2023, there were, I believe, 2 different articles, clinical research articles published in JADA. So make sure you look that up, because there is a lot of science behind it. And the cool thing is that, coupled with the radiographic AI technology, really then is going to reveal a lot of potential areas for treatment. And it's very fast, so it can be done same day. And so that's a really neat way to serve patients. And also it's a great opportunity to expand the hygiene service mix.
Would you like to hear more? Follow the link for the full episode.